Good morning, ladies and gentlemen. Welcome to Acupuncture and Moxibustion class. Before this class, we have discussed acupuncture treatment of hemiplegia after apoplexy. Today, I'm going to talk about the acupuncture treatment of headache. Have you suffered with headache? I believe the answer for most people is yes. Then, I'd like to give a brief introduction to headache. Headache, a common subjective symptom in clinic, can be seen all year round. All kinds of pathogenic factors may cause disorders in the meridians of head, leading to disharmony of the qi and blood, and headache occurs consequently. In Western medicine, headache is the main symptom of many acute and chronic diseases, such as hypertension, encephalitis, meningitis, acute cerebrovascular diseases, and glaucoma, obstruction of collaterals, or malnutrition of the brain may result in a headache as well. Therefore, headache sometimes can be caused by traumatic injuries. Acupuncture and moxibustion respond not well to this kind of headache. The headache we mentioned here must exclude the various organic diseases. Now, let's go to this slide and learn the diagnosis of headache according to the meridian identification. Do you remember the famous saying that head is a convergence of all yang meridians? It means that all three yang meridians of hand and three yang meridians of foot go to the head. These three pictures showed the courses of large intestine meridian, triple and jasor meridian, and small intestine meridian. These three pictures showed the courses of stomach meridian, gallbladder meridian, and bladder meridian. The liver meridian of foot, Jue Yin, connects with the governor vessel at the vertex. Based on the distribution, headache can be diagnosed with meridian identification, which was described as follows. Pain of Yangming headache appears in the forehead, Shaoyang headache on the lateral side of the head, Taiyang headache in the occipital region, a Jue Yin headache at the apex of the head. In this slide, occipital headache, temporal headache, and frontal headache are showed to all of you, according to the meridian identification of headache. The treatment of this disease will be discussed. The principles for treatment include dredging meridians and collaterals, and promoting qi and blood. And we should select the corresponding points in accordance with the distributions of meridians. For example, Yangming headache, pain on the forehead, points Yin Tang, governor vessel 29, 头围 stomach 8, 合谷 large intestine 4, and 内庭 stomach 44 usually can be applied. In the point combination, Yin Tang, governor vessel 29, and 头尾 stomach 8 are localized points which could harmonize qi and blood on the forehead and relieve pain. 合谷 large intestine 4 and 头尾 stomach 8 could drive the qi of hand Yangming meridian and foot Yangming meridian, respectively. Then, let's go to the location of the points you are concerned about. 印堂 Governor Vessel 29 is located on the midpoint of the line, connecting the medial ends of the two eyebrows. 头尾 stomach 8 0.5 寸 straight above the corner of the anterior hairline. 合谷 large intestine 4 is on the dorsum of hand, between the first and second metacarpal bones, approximately in the middle of the second metacarpal bone. The location of 内庭 stomach 44 is proximal to the wide margin between the second and third toes, at the junction posterior to the toe web of the right and white skin. If you can find the above points accurately and point them with filiform needles or pinch with your fingernails, the pain relief will come fast. Now, let's move on to this slide. 少阳 headache. Pain on the temporal region. Points 太阳 externally head and neck 5, 外观 triple analgesia 5, and 帅骨 gallbladder 8 are often selected. In this point combination, 太阳 externally head and neck 5 and 帅骨 gallbladder 8 are localized points which could harmonize qi and blood on the lateral side of the head and relieve pain. 外观 triple analgesia 5 and 帅骨 gallbladder 8 could drive the meridian qi of hand 少阳 meridian and foot 少阳 meridian, respectively. I guess the next question is, how could we locate these points? 太阳 external points head and neck 5 is located in a depression about 1 finger breadth posterior to the midpoint between the lateral end of the eyebrow and the outer canthus. The location of 帅骨 gallbladder 8 is 1.5 寸 from the apex of the ear straight into the hairline. 外观 triple analgesia 5 is on the dorsal aspect of the forearm, 2 寸 above the transverse crease of the dorsum of the wrist. On the line connecting 阳池 triple analgesia 4 and the tip of the elbow between the radius and ulna. Applying kneading at 太阳 and 外观 are also effective for headache caused by the common cold. Then, we will discuss the point selection for 太阳 headache. Pain on the occipital region. Beside the local acupoints, 后溪 small intestine 3 and 昆仑 bladder 60 are often added. Can you see the rough location of 后溪 small intestine 3 from the picture? It is located on the ulnar side of the hand. When the loose fist is made, proximal to the 5th metacarpal phalangeal joint, at the top of the transverse crease and the border of the right and white skin. we can find Kunlun bladder city in the depression between the prominence of the external malleolus and the Achilles tendon. These 2 points can be applied to joint and regulate qi and blood of hand Taiyang meridian and foot Taiyang meridian, respectively. Pain is relieved with improved blood circulation. Finally, point selection for Jueyin headache, pain on the vertex, will be talked about. We often choose Baihui, Governor Vessel 20, and Taichung, Liver 3, to deal with this condition. Baihui, Governor Vessel 20, a localized point on the vertex. At the junction of the midline at the vertex with a line joining the 2 ear apexes. Taichung, Liver 3, an important point of liver meridian on the foot, is located in the depression distal to the junction of the first and second metacarpal bones, just as shown in the picture. The needling or pressing at these 2 points could significantly relieve the headache on the vertex. Maybe you could have a try by yourselves. Now, let's go to the summary. Headache responds very well to acupuncture treatment, except those caused by organic diseases. During the treatment, doctors should pay more attention to the meridian differentiation, take the distribution and courses of meridians into account, and choose appropriate acupoints and manipulations. Patients should be advised to quit smoking and drinking alcohol, avoid wind and cold, emotional disturbances, and greasy food. This class, we have learned the acupuncture treatment of headache. I believe most of you are able to differentiate headache according to meridian identification. If you are interested in the lecture, please study them by yourselves in details. That's all for today. Thank you for your listening. Next class, we'll learn acupuncture treatment of common cold. See you next time.